CF can be an invisible disease. Just by looking at me, you wouldn't know what I go through every single day. CF is different for each person. Your health can also change drastically from day to day. One day you can be fine, and the next day you're in the emergency room. Doing the required medication regimen is imperative, but so is taking care of your mental health and happiness. If you aren't feeling well emotionally, it'll be very difficult to take care of yourself physically. My health has to be the factor in every choice. I put on a brave face for the world, but I don't always feel brave. But I try to always maintain optimism and believe that things will get better. There are so many life lessons that CF has taught me. I have a deep appreciation for life, always striving to live life to the fullest and not sweat the small stuff. I have a close relationship with my loved ones and a passion for helping others. I have many hard days, and I've learned to appreciate the good days that much more. I have also learned that if I don't feel well, nothing else really matters, so I try my very best to always prioritize my health. It is not easy, but I know that I can't take care of others if I'm not taking care of myself first. When I meet people and when I share my story, I really want people to know that I am a fighter. I am incredibly determined and resilient, and CF has really made me that way because of everything that I've been through. I am living proof that one person can make a difference, because I wouldn't be here today without the help of incredible people that have just volunteered their time and energy to help those of us with CF. I am proud that despite many setbacks throughout my life, I have continued to achieve my goals. I find that it's not only important to plan things to look forward to in the future, but to also look back and be grateful for what we've accomplished. And I'm grateful for each day, and that motivates me to keep fighting. I'm also highly motivated when I see my beautiful son smiling at me. He keeps me focused on what matters most.
Tobipodhaler, or tobramycin inhalation powder, 28 mg per capsule, is a prescription inhaled medication for cystic fibrosis patients whose lungs contain bacteria called Pseudomonas aeruginosa. It is not known if Tobipodhaler is safe and effective in patients under 6 years of age, in those with lung function outside of a certain range, or in those whose lungs contain bacteria called Burkholderia cepacia. Important safety information. Do not swallow Tobipodhaler capsules. Tobipodhaler capsules are used only with the Podhaler device and inhaled through your mouth or oral inhalation. Never place a capsule in the mouthpiece of the Podhaler device. You should not use Tobipodhaler if you are allergic to it or to any other aminoglycoside antibacterial medicines. Tell your doctor before starting treatment all of your medical conditions, including if you have or have had hearing problems, dizziness, kidney problems, muscle weakness, breathing problems such as wheezing, coughing, or chest tightness, if you had an organ transplant, are pregnant or nursing, or plan to become pregnant or nurse. Tobipodhaler contains a medicine that can harm your unborn baby. It is not known if it passes into breast milk. Check your baby for watery stools, bloody stools, thrush, or diaper rash if you breastfeed. Tell your doctor about all the medicines you take, including over-the-counter medicines, vitamins, and herbal supplements. If you are using Tobipodhaler, discuss if you should take other medicines that may harm your nervous system, kidneys, or hearing. Water pills or diuretics such as Edequine or ethocrinic acid, Lasix or furosemide, or intravenous mannitol, urea. Tobipodhaler can cause serious side effects, including severe breathing problems or bronchospasm. Tell your doctor right away if you get shortness of breath with wheezing or coughing and chest tightness while using Tobipodhaler. Hearing loss or ringing in the ears or ototoxicity. Tell your doctor right away if you have hearing loss, noises in your ears such as ringing or hissing, vertigo, difficulty with balance, dizziness, or your mother has had hearing problems after taking an aminoglycoside. Tell your doctor if you have been told you have certain gene variants, a change in the gene related to hearing abnormalities inherited from your mother, worsening kidney problems, or nephrotoxicity. Tobipodhaler is in a class of medicines that may cause worsening kidney problems, especially in people with known or suspected kidney problems. Your healthcare provider may do a blood test to check how your kidneys are working while you are using Toby Podhaler. Worsening muscle weakness. Toby Podhaler is in a class of medicines that can cause worsening muscle weakness in people who already have problems with muscle weakness, myasthenia gravis or Parkinson's disease. Toby Podhaler is in a class of medicines which may cause harm to an unborn baby. The most common side effects of Toby Podhaler include cough, worsening of lung problems or cystic fibrosis, productive cough, shortness of breath, fever, sore throat, changes in your voice, hoarseness, coughing up blood, and headache. Let your doctor know if your symptoms worsen or if you have a side effect that bothers you enough to stop treatment or that does not go away. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please see full prescribing information and patient information.